Right now, it's Southern California's news leader with Ellen Leyva, David Ono, and Chief Meteorologist Dallas Raines, and the best of Hollywood with George Pinocchio. Now, ABC 7 Eyewitness News.
There was a time when being diagnosed with HIV was considered a death sentence. Thanks to medical research and advancements in science, that is no longer the case, but federal cuts are raising concerns. Thanks again for joining us here on ABC 7 Hulu and wherever you stream. I'm Ellen Leyva.
And I'm David Ono. The data released this week shows the DOGE task force claims they pulled $109 million in federal grants from UCLA. A lot of that money was funding critical HIV research and care. Circle of Health reporter Denise Dador joins us now to share how those cuts are already impacting people in treatment.
Heartbroken, that's how you can describe how they feel right now. One study that had enrolled more than 200 HIV-infected participants was forced to shut down midstream. It can be hard to get a sense of the true impact of those cuts just by looking at the numbers. So I sat down with two people who participated in UCLA research studies, the very ones that are getting cut, to take a closer look at how that action could affect them and the future of medical research.
I feel like I've lost part of my health care.
When 54-year-old Daniel Garza was diagnosed with HIV in 2000, he was dealing with alcohol and drug addiction. 9 years ago, he joined the UCLA M study dedicated to identifying the obstacles that patients like Garza face and how to overcome them so he can stay on his medications.
And we're going to get our lab works, and they're going to catch anything that's going on with us, like they did in my case. That's a benefit, and that's a win across the board.
I can genuinely say, without M study and without the LGBT Center and all of my supporters, I don't think I'd be sitting in front of you right now.
In 2019, 27-year-old George McLaughlin was in shock and disbelief after taking an HIV test.
Immediately you feel alone and ashamed.
He thought it was a death sentence. Then, with UCLA researchers, he learned how to live a healthy and productive life.
Keeping people living with HIV in care means they don't have viral load. That means they're not able to transmit HIV.
UCLA's Dr. Pamina Gorbach was starting a new trial, building on the success of the M study. McLaughlin and Garza, along with 200 other participants, were all enrolled. Then the government pulled the plug.
When I got the notice, it was kind of like an immediate pit in my stomach. I still feel sick about it.
Over $3 million had been awarded for this grant, and over 5 years.
Dr. Gorbach said the termination letter implied her work was unscientific. It stated a low return on investment and ultimately did not enhance health, lengthen life, or reduce illness. Participants wholeheartedly disagree.
With someone like me who has been living with HIV for about 5 years now, but is still able to maintain a successful and healthy life.
Prevention, lab work, medications, a regular doctor visit. It helps me to maintain my numbers up.
Basic human needs, you know what I mean? It's really foul and unfortunate.
Dr. Gorbach says she's had to stop her research operations and plans to appeal the government's decision. According to DOGE, UCLA lost the most amount of funding compared to other UCs and other universities across the country. Participants say they're grateful for the work the researchers have done, but have no idea how they will fill this huge gap in their care. Denise Dador, ABC 7 Eyewitness News.
A distressing situation. Thank you so much, Denise.